one of the most important researchers in adherence came up with this sentence in a JAMA paper reviewing what we know about adherence to therapy. And yet, as you read it, you recognize some of the ways we sometimes handle patients that don't seem to show personal responsibility. We threaten them. If you don't take your insulin, you lose your eyesight, you lose your kidneys, you lose your legs. We'll have to chop them off. We like to use those graphical words. But patients reject this and run away. And those that don't seem to improve their adherence. The few that do reinforce the behavior. So you'll hear some clinicians say, oh, I threaten my patient all the time. They come back and they're right where I want them. But what about the ones that didn't come back? And it's very interesting because you just have to go to any chat room on the web, that in any blog, any user group place on the web where patients with diabetes can talk to each other, and you will see them again and again and again saying, oh, I haven't gone to see my endocrinologist or my clinician because I'm afraid what they will say when they look at my A1C, when they look at my weight, etc. So clearly this is not the way of engaging a patient with chronic conditions. So one aspect is this intentional noncompliance. But again, I don't think it's the whole story. But what do we do about it? Well, I think some of you have, I think, quite a bit of ideas about this. You need to educate patients better, and so improving professional communication, patient education, some behavioral interventions, motivational intervention, all these things contribute in this sort of regard.